Well, imagine going to urgent care and then being told the wait list is several weeks long.
Well, something similar is happening right here in Wisconsin. People in dire need of mental health care are being told they have to wait. CBS 58 investigates. Bill Walsh checks in with overwhelmed therapists to find out just how bad that crisis is.
We introduced you to Marissa Bailarian back in November.
You can do it. You can take that next step.
She spoke with us to encourage people to seek help, to help stop the stigma around mental health care.
When I first did the interview with you, it was, I felt like I was doing okay.
Little did she know then the pandemic would prove too tough for her to navigate alone.
It started just bubbling up, and I just got to a point where I had suicidal thoughts again.
With her therapist unable to add appointments, Bailarian sought more help.
I made the phone call to Rogers.
Wanting help, she got put on a wait list.
I waited about a month or so until I could finally get into the program because of how many people were wanting to get help.
Marissa's story is common in an overwhelmed mental health care system.
The messaging we're hearing is, hey, call us back in 2 to 3 months, or call us back in 9 months and see if we have a wait list or any openings then.
Morgan Agian is lead therapist for Rogers Memorial Health.
And I don't think anybody enjoys sending that message for somebody who's calling to get that help.
In extreme cases, people who can't make appointments for other programs are checking themselves into hospitals.
People just feel that desperation so much that feels like their only option to be able to see somebody.
Dr. Kelly Dugan is a clinical psychologist in private practice, one of many trying to open up their schedule to keep up with demand.
But I think the other thing that we're seeing too, related to COVID, is the burnout among healthcare professionals, including psychologists, but more importantly, the first responders.
The results of this crisis are striking. A recent CDC survey estimates that 41% of people report at least one mental health condition. 1 in 10 seriously considered suicide.
We're seeing an increase in suicides, domestic violence, intimate partner violence, overdose deaths.
Marissa Bailarian found the help she needed.
I'm thankful that I went back.
But what should you do if you need help and that help isn't available right away? Well, don't give up trying to find a professional, and lean on your support system, your family and friends.
And I know self-care kind of can come off as a cliche, but really doing whatever you can to boost your mood.
Try to give yourself a little bit of joy each day and look for the positive in things rather than continually focusing on the negative aspects of what's happening.
If there is a small silver lining in this mental health crisis, it's that seeing a therapist may one day be as common as getting a yearly physical.
And I think that people are starting to realize the importance of what their struggle is and then getting help.
If something isn't right with you, the time to seek help is now. Don't wait, and keep calling. The National Suicide Prevention Hotline is 800-273-TALK. I'll also put some local numbers for you to seek help on our website, cbs58.com. I'm Bill Walsh.